Welcome to the pre-recorded suicide prevention and intervention webinar. My name is Shantae Stokes, and I'm a senior associate with the Readiness and Emergency Management for Schools Technical Assistance Center, also known as the REMS TA Center. During this webinar, we will speak with some of our partners from the state of Connecticut. They will give a guest presentation and they will share information about their collaborative suicide prevention and intervention efforts throughout their state. And they will also share a case study. Now, Janelle Hughes, Principal and Project Director of the REMS TA Center, will kick things off.
We all know that schools are crucial settings for youth mental health support and suicide prevention activities. And recent data from the National Survey on Drug Use and Health shows that there are very similar proportions of youth who are receiving mental health care from schools as from outpatient mental health settings. Specifically, 35% of adolescents have received mental health treatment in a school setting, 23% have received it in both a school and non-school setting, and 42% receive treatment in a non-school setting. So that really highlights, again, the important role of schools, school districts, and their partners in providing support to the whole school community with ensuring that our students have all of the supports that they need. Our partners from Connecticut, in a minute, will dive into how they collaborate across agencies to provide these supports, and they'll also be sharing some case studies that really illustrate that collaboration. And with that, I am so happy to introduce our presenters for the day. Andrea Duarte is a behavioral health program manager, in the Prevention and Health Promotion Division of the Connecticut Department of Mental Health and Addiction Services within the Office of the Commissioner. She oversees federal and statewide initiatives and contracts, is the Suicide Prevention Project Director, and the Employee Assistance Program Liaison. Ms. Duarte chairs and participates in multiple state and national advisory committees and is a founding member of the Connecticut chapter of the American Foundation for Suicide Prevention. Dr. Stephanie Bozak is a behavioral health clinical manager at the Department of Children and Families in Connecticut. In this role, she oversees the Children's Community Mental Health Unit, which is part of the Behavioral Health Community Services Division. She serves as Tri-Chair for the Connecticut Suicide Advisory Board and is a member of the Connecticut Psychological Association, as well as the American Psychological Association. Emily Morse is a Connecticut licensed clinical social worker and the program manager for the Mobile Crisis Intervention Services at UCFS Healthcare. Prior to her position as the program manager, Emily began as a crisis clinician, then later as a supervisor for the program, providing critical crisis intervention for youth experiencing behavioral and mental health crises. She is also a member of the Regional Suicide Advisory Board and the Regional Crisis Team for Eastern Connecticut. Kylie Young has been the Regional School Safety Coordinator with the Center for School Safety and Crisis Preparation within the state since 2002. In this role, Kylie supports school districts across Eastern Connecticut in prevention and response efforts related to all facets of school safety. She has more than a decade of experience as a social worker and has worked as a school social worker in community mental health and as a therapist in private practice. So Kylie brings her experience in trauma-informed care to her work at the center and is particularly interested in student mental health, supporting interagency collaboration, crisis response, and prevention efforts focused on school climate. And following a 26-year career with the state of Connecticut's judicial branch, concluding as a regional manager with juvenile probation services, Mr. Mark Irons assumed his new position as the suicide prevention lead with the Southeastern Regional Action Council in 2021. A prevention nonprofit that works across the lifespan on substance misuse, gambling, mental health, and suicide prevention in 41 communities of Eastern Connecticut. As the coordinator of the Connecticut Regional Suicide Advisory Board, Mark assists in developing the framework and activities needed to address suicide prevention and postvention planning through collaboration and coordination among a variety of state and local agencies. So again, a special thank you to our presenters in advance for joining us today. And with that, I will turn things over to Andrea.
Thank you, Janelle. If you could advance, thank you. First of all, I just wanted to say thank you for this invitation. It's an honor to be able to present to you today our continuing efforts of developing post-vention response to support the state. This is a view of some of the state suicide prevention campaign efforts that have been going on through the years. Our collaboration with our little guy Gizmo there in the center. Some of you may be familiar with the Gizmo's Possum Guide to Mental Health, which has made some appearances in multiple states across the United States. And if you aren't familiar with that resource, we'd be happy to share that information with you later. And we also have a signage project, as you can see on the lower right, related to co-branding 988 on some of our roadways with our message for 211, since we've been using 211 for over 10 years with co-branding for suicide prevention. So we're really excited to share our information with you today. If you could advance, please. Again. So I think the first thing that's important to always bring up is about self-care. I'm sure all of you are in very challenging roles. And one of the things that we always have to remind ourselves and other folks that we're collaborating with is that you can't pour from an empty cup. It's important to take care of yourself. So if at any time you need to take a break from this conversation, please feel free to do that. And we certainly would love to have you come back and join us in the conversation at the end. Can you advance, please? So to give you some context, the State Suicide Advisory Board that Stephanie and I co-chair with our colleague Ann Daigle, who represents the Daigle Foundation, has been in existence for quite some time, but we did have an update in our 2022 legislation that really solidified our coverage of lifespan suicide prevention, intervention, and response. Prior to that time, the mandate that we have in legislation was really only focused on youth. So being able to expand the legislation to address the entire lifespan has really been wonderful for our entire coalition and continuing development of our formal board. Our mission, as you can see, is it's to reduce, sorry, not to reduce, it's to address the problem of suicide with a focus on prevention, intervention, and response in various ways. And our vision is to eliminate suicide by instilling hope across the lifespan through the use of culturally competent advocacy, policy, education, collaboration, and networking. At one point, we did have the word reduce suicide there instead of eliminate, but in 2015, we adopted zero suicide as a state. And if you're not familiar with that model related to primarily healthcare systems, it's to address gaps in healthcare that potentially could lead to suicide risk for patients or clients in their care. So can you advance, please? So the state's, ooh, too far. Or is this the next one? Thank you. So the State Suicide Advisory Board does have a lot of resources, and we have seven different committees that oversee our various initiatives directly related to our state plan. We'll be going over that in a moment, just to share a little snapshot of that. But free materials, there's no cost for membership. It's operated by the state agencies, Department of Mental Health and Addiction Services, and Department of Children and Families. And you can see the resource links there below. If you could advance. Thank you. So part of we're really proud that we've been able to expand the infrastructure in the past few years to include our regional suicide advisory boards, one of which you see there is CRAC that Mark is here to represent, and he will talk about that later. But it's important to understand so that there's the state level suicide advisory board connects to these 5 regional suicide advisory boards. They're completely operated under state funding, state and federal funding through block grant support, as well as ARPA funding right now, our American Recovery after the COVID pandemic. And we're looking to continue the support of those. They have been just instrumental in so much of our prevention, intervention, and response work over the past few years. We did try out having regional coordinators during one of our Garrett Lee Smith grants and found that very successful. So we've been really pleased that we've been able to institutionalize the regional suicide advisory boards to help support the infrastructure for the state. Can you advance, please? I mentioned our state plan briefly. We do a state plan every 5 years, and we're about to embark on our next mission after we receive the National Action Alliance strategy. Hopefully they'll release that soon. We're going to be updating our plan for 2030. And so these are the 5 primary goals. We've been very focused on these the last 2 plans, so the 2020 plan and the 2025 plan, because we're very steeped in the addressing the goals and objectives. So really, and these are a subset of the national strategy. So if you're familiar with the national strategy, there are 13 goals. And we went through a prioritization process as a state coalition to identify the 5 priorities. And as I said earlier, we do have committees under the state board that align with these goals as well as other efforts. If you could advance, please. Within our work for the state plan and the state coalition, we really use the comprehensive approach to mental health promotion and suicide prevention through the Suicide Prevention Resource Center. And postvention, as you can see, is a key component of this entire approach. If you can advance, please. So what is postvention and why does it matter? So in Connecticut, we started postvention work about, I would say, 12 years ago, and it started very organically. There was unfortunately a few losses in one community, and the school system community wanted to respond appropriately using safe messaging, support to those who are grieving, and really wanted to make sure that they could stop some of the contagion that was happening, because there were some relationships between some of the losses that were happening. And so those of us who were involved at the time at the state level, really it was Department of Children and Families, State Department of Education, Office of the Child Advocate. We felt it was very important that we get aligned in our messaging to the community and support to them. We didn't have the same resources 12 years ago that we have now. And so today we'll be able to talk to you about what we have now. But it's been really helpful to be able to coordinate through the Suicide Advisory Board collaboration that we have across these different state agencies to make sure that we have consistent messaging that's based on evidence-based and best practice. So it's important that the response is timely in order to reduce the risk to others and get that support immediately to those who need it, and support a response that will not potentially negatively impact vulnerable populations and can help the community and school move forward through that grief process back towards a stabilized environment, and also hopefully back towards maybe some efforts in prevention. If they're willing. Sometimes they're not always willing, but we'll talk about that in a little bit. But if you could advance, please. So I believe, Stephanie, this is your slide.
Yep. Thank you, Andrea. So as part of the postvention response process in Connecticut, we really rely on the integration and coordination of a lot of different key partners in this work. Part of that is, of course, the Connecticut Suicide Advisory Board Postvention Response Subcommittee, where we promote best practices, support the coordination, and really provide ongoing consultation and guidance to folks. We also host community conversations where discussions can be had, really aiming to learn from what has happened and move that work forward. It also involves the Connecticut Office of the Chief Medical Examiner, where we get responses or we get notifications regarding any untimely deaths. And that sort of alerts our system and a coordinated response for how we're going to provide support after a notification. It also involves the Connecticut Office of Child Advocate, as well as the Department of Children and Families. Next slide. So, oh, this is Andrea.
Yeah, I think, If you could go back one, thank you. Thanks, Stephanie. So I don't know if you wanted to mention as part of DCF, your notification of your system.
Sure. And we'll talk a little bit more about this, and Emily Morse, who's actually here from Mobile Crisis, will go into depth about this. But as DCF, the Department of Children and Families, we fund the Mobile Crisis for Youth teams, which is a mobile crisis unit that can go out and provide support. So the Department of Children and Families will make those notifications to the appropriate team.
Thanks, Stephanie. So similar to what Stephanie just described, Department of Mental Health and Addiction Services oversees the adult mobile crisis response. In our state, we do have 2 state agencies that oversee the lifespan together for mental health and substance. And so in terms of treatment and prevention and intervention. And so the adult mobile crisis system is under DEMIS. So when there's a notification, we also notify the adult mobile crisis system to ensure that there is a response potentially to the adults that are involved. So a lot of times when, for example, you all are representing schools or working with schools, the focus is on the children, but obviously the faculty, staff, and other adults in the community may be highly impacted, not to mention the family members. So it's been really important to make sure that there's a co-response, and that's what we'll be discussing in a little bit. The other piece of this that's important is those regional suicide advisory boards. So it's my responsibility, and if I'm not around, then DCF, to notify the appropriate region that's impacted. And so whether it's Mark or another counterpart, we will reach out to them to let them know of the loss so that they can connect to the community folks to promote the best practices and post-vention activities, and make sure that they're coordinating efforts with the adult and children's mobile services, as well as the state resource center, which they'll talk about in a moment for safety. The other piece of this, which has been really important, and unfortunately this has happened recently, sometimes there's a loss that affects another state. For example, a student on a campus who may have been a resident of another state, but actually attends a campus in Connecticut. And so part of my role is to reach out to my counterparts in other states as well, to make sure that they have an awareness and that they're able to activate supports in the communities that are impacted at their local level. Sometimes it's also necessary to engage our public information officer in the event that media picks up on a story, and we need to somehow address the safe messaging that media should be covering. And it doesn't happen very often. We've done a lot of education in our state around the appropriate messaging related to sharing stories when there's been a loss to suicide. So it's gotten a little bit better. So the other party that's involved at the state level is the State Department of Education. They're very helpful in doing 2 primary things. Sometimes we will experience a challenge connecting with a school that has had a loss, and so they may reach out to the administration to encourage the connection and make introductions. Also, they can help determine if there have been impacted siblings that are also in the school systems. For example, you may have a loss that's of a 18 or 19-year-old, and they can even look to see if there's a relation that could be impacted at a younger sibling. And that's important that we're engaging supports for that new survivor. Can you advance, please? As I mentioned, the School Safety Center for crisis preparation, they're a little bit newer in the past, I'd say 5 to 10 years, collaborating with us around our post-vention response. It's been a really great collaboration. We're still trying to figure out exactly how all the cogs and and wheels fit together and everything. But it's been wonderful. Like, we're all have good intention to do the right thing, and also are very passionate about collaborating and making sure that we're coordinating our resources. And Kylie will talk about that in a little bit. Also, the foundations in our state. I mentioned the Brian Daigle Foundation is a tri-chair of the State Suicide Advisory Board. Prior to that, the American Foundation for Suicide Prevention had a chair as well. And the Jordan Porco Foundation, if you're not familiar with them, they have the For What's Next program, as well as the Fresh Check Day. All of these are the Brian Daigle and Jordan Porco are Connecticut-based foundations, and then of course the chapter for AFSP, very active in our work and have a lot of connections across the state. And so it's been very helpful in terms of responding to survivors' needs to have the foundations as part of the response process. Can you advance, please? And Mark, I think this is where you take it over.
Thank you, Andrea. Talking a little bit about the Regional Suicide Advisory Board. I'm one of 4 people across the state that organize these Regional Suicide Advisory Boards. I'm very fortunate I have amazing colleagues that meet on a regular basis to disseminate that information that comes from the larger state advisory boards and gets it out to our local communities. I see a bunch of people across the country from very large states. We are a small New England state, but I do serve 41 communities in Eastern Connecticut, which encompasses all of New London, all of Windham, and part of Eastern Tolland County, which if you look on a map, encompasses 41 communities. So I'm trying to bring together all of those folks. I work for Southeastern Regional Action Council. It's a mouthful, but it's a prevention nonprofit that works across the lifespan on gambling prevention, substance misuse, mental health promotion. I work specifically in the suicide prevention space. And in that role, I'm the coordinator of our Regional Suicide Advisory Board. All of our funding comes from my partners that are on the call from the Department of Children and Families, as well as Department of Mental Health and Addiction Services. It's important to recognize the work that we do in trying to bring together and coalesce the efforts that are happening across the region. Next slide, please. And in that work, when I took over a couple of years ago, we had about 36 members. Right now, we're about up to 131 members. We meet on a monthly basis with a set agenda that covers both prevention and postvention. In particular, we usually have a presenter that shares information on a specific topic of interest to our region based upon data, as well as issues that members might bring up. We then have opportunities to coordinate and collaborate on efforts that are occurring. It's important to recognize that you'll hear from both Emily and Kylie, and their organizations and themselves are members of our Regional Suicide Advisory Board and that are active participants in our process. It's really disseminating information, again, across the lifespan. We have folks that come from lived experience to school personnel to mental health professionals, law enforcement, medical. Additionally, in that role, I provide an overview of postvention to organizations that want that. That could be a community, it could be a business, it could be a school setting, as well as further follow-on, which might assist them in develop individual postvention plans for their schools, as well as postvention team development. And then lastly, one of the things that we do is provide post-traumatic stress management group, or PTSM, based off of the psychological first aid model at the right time within the postvention process. So we come in and provide non-clinical opportunities for folks that have been impacted by a loss. And now I'll turn it over to Kylie.
Great, thanks, Mark. If you could, thank you, perfect. So the Connecticut Center for School Safety and Crisis Preparation was established in 2021. I know Janelle said that I've been in this role since 2002, but unfortunately, it's just been since 2022, then to 2022. So we work with school districts across Connecticut on a wide spectrum of school safety related topics that range from safety planning and professional development to crisis response. But today I really just want to focus on the things that align with suicide prevention and postvention efforts. So the primary vehicle for this is the development of a regional crisis team. We have multiple regional crisis teams across the state. One of the unique challenges that we face in Connecticut is that we don't have any county or township governmental structure. So all of our towns tend to operate as islands, and they all tend to have their own school districts. And what that means is that the resources district to district might vary wildly from town to town. And what we've learned is that in the face of a crisis, such as a death by suicide or another untimely death of students or a staff member, the school-based professionals are also impacted by that. And they're grieving themselves, and they might not have the capacity to support their students or their colleagues in the ways that they might in a day-to-day basis. So the regional crisis team is developed of mental health professionals who work in schools across the region. My region's just a little bit bigger than Mark's. We cover 56 towns in Eastern Connecticut. And so that team meets on a monthly basis for community building and professional development. And everybody on that team receives some aligned training in order to be able to respond on a voluntary basis if a crisis occurs that overwhelms a district's ability to respond with their internal resources. And so often what ends up happening and when that occurs is that I act as a liaison between the school district and the team to create a specialized response that meets that district's specific needs. In addition to that, we engage with districts on prevention and planning efforts that might include things like crisis communication planning, things like memorial policies, and we also, the crisis response may or may not include the regional crisis team. Sometimes schools just need some resources or just somebody to talk through what their response plan looks like. We also, as a center, offer professional development specific to this. We use the National Association of School Psychologists Prepare model. So workshop 1 is really about multi-hazard crisis planning, and workshop 2 is focused on those mental health crisis interventions. So that tends to be the bulk of kind of where we operate for this. As a center, we also conduct research on various school safety related initiatives. However, there hasn't been anything specific to this field that we've engaged in thus far. But that's where we land. So I'll pass it over to Emily to talk a little bit more about mobile crisis.
Great, thanks, Kylie. So Mobile Crisis is a hospital diversion and crisis stabilization program that's offered throughout the state of Connecticut, and it's for youth 17 and younger and 18-year-olds who are still in high school. And so the team is comprised of master's level clinicians and case managers, bachelor's level case managers, who respond to crisis calls in the community for youth who are experiencing a behavioral or mental health crisis. Our services are available 24/7 every single day of the year. So that's a really great part of our program. As of last year, we moved to 24/7. How folks reach us is by dialing 211, or you can also dial 988 to get connected with Mobile Crisis. In terms of the crises that Mobile Crisis handles, the crisis is really defined by the caller. So if it's a crisis for the caller and the youth, it's a crisis for us. That being said, we frequently receive crisis calls for youth experiencing thoughts of suicide, youth who are engaging in non-suicidal self-injurious behavior, disruptive or aggressive behavior, homicidality, aggression, depression, anxiety, school refusal, family conflict, that sort of thing. We are grant funded by DCF. And so one really wonderful part of our program is that families will never see our bill for our services. And we are also unlimited use. Just like Mark's team, we cover the 41 Eastern towns in Connecticut. Again, it's statewide, but this is just specifically UCFS, my team. In the last year, so in 2023, my program received over 1,400 crisis calls. It's worth noting that of those, 44% of the kids that we worked with had risk of harm to self, so suicidality or thoughts of self-harm as their kind of primary presenting problem. So suicidality is a really prevalent presenting issue that we're seeing for the kiddos that we're working with. As Stephanie mentioned, Mobile Crisis gets notified by DCF for about untimely losses of youth, including suicide losses. In 2023, my team was notified of 13 losses in the community. 6 of those times, the RCT, so Kylie, contacted the school directly. 2 times Mobile Crisis did. That was, again, in collaboration between our programs. And in total, my team provided or participated in 7 grief responses, 5 of which included other members of the RCT. And Andrea, I will hand it off to you for the next slide.
Thanks, Emily. So similar to the children's side, there are resources for adults, and adult mobile crisis services are organized pretty differently compared to the child side. We have half of them are state operated, half of them are not under nonprofits. There are 18 teams that cover the entire state, and they are working towards 24-hour, 7 days a week coverage at all of the sites. The majority of them have gone to 24/7. We have some stragglers that are part of the state system due to union issues, no surprise there. But it's part of our crisis service system expansion under the 988 initiative. I'm actually the co-project director for 988 as well, and Stephanie is too. So we're doing a lot to expand resources for the state for these folks that are in need, in distress, or considering suicide. They are able to provide mental health screening, suicide risk assessment based on the national best practices. They work very collaboratively with police. That we have an extensive crisis intervention team system in the state where there's a collaborative response with police. As needed, the mobile crisis can also do an emergency certificate. Only in our state by law can the adult and children's mobile crisis providers do emergency certificates, as well as police. There are no other clinical providers that can do that in our state. And then they certainly provide resources, follow-up contacts. They can also do critical incident stress management debriefing. We were actually talking about that this morning. We had our post-vention committee this morning. And it's important that to be aware that although this system from the DCF-DMIS perspective that we're talking about today is in response to post-vention for suicide prevention, there have been numerous times when the system has been engaged for other types of losses. So for example, Emily mentioned a 13, and I know that you didn't have 13 suicide losses of children last year in your region. So I know that you're responding to other kinds of losses as well. And certainly those that could potentially impact children, like if there was, like a teacher or a coach or someone like that, for example, it often is very impactful in a school system. So just to give you some information about the adult side. And now back to Stephanie.
Thank you, Andrea. Next slide, please. Thank you. So in terms of the post-vention protocol recommendations, as you've heard, it really takes a village and a coordinated response. And one of the recommendations is really that the protocol is developed and managed by a team that represents the different sectors involved in the community. So as you've heard, from us, it really takes the various partners that we've talked about, and other important partners could be the public health, police, fire, different faith-based organizations, whatever is most relevant in that community. And it really should be tied to positions rather than specific individuals. We're really also saying that the recommendation should ensure that whatever the process and protocol is, establish clear, understandable procedures that are free of jargon. A lot of times people in this field use specific words that may not be as understandable for those who are in the community. So making sure that we're not using jargon. It's also ensuring that communication is open among all the team members. So as you've heard Emily talking about, sometimes the communication comes from the crisis center. Other times it comes from mobile crisis when they're reaching out to schools to respond. But making sure that the communication channel is clear, and among the team members, there's one point of contact. We also want to make sure that the first and foremost is to secure public safety and ensure that we're quickly mobilizing to organize the resources that are going to be available to whoever we're supporting. Next slide. In addition, we want to make sure that whatever the support is both immediate and long-term. One of the things that we have heard and talked about from our communities and those with lived experience is that oftentimes after the crisis, there's a rush to support, but then after that, what happens? And so the recommendation is really to make sure that we're thinking about both those immediate needs, but also about long-term plans as well. I think actually earlier today in one of our meetings, it was mentioned that a school actually reached out and were thinking about graduation. They had a loss earlier in the year in the fall, but now they're thinking about and asking for what support should we ensure that our students have now that it's coming to graduation time. So really considering both the immediate and the long-term plans. We also want to make sure that we're specific, but also flexible. The needs of each situation are going to be different. And so while we want to have parameters and be specific enough to provide that support, we also want to be flexible to make sure that we're meeting the individual needs of that community that's experiencing the loss and needs support. We want to make sure that we are free of bias and that we're considering ethnic, racial, and cultural, and spiritual and sexual orientation and identity, and making sure, again, that we're flexible enough to address the unique needs of that particular community. We also want to make sure that we are addressing complex mental health issues, right? So there's the immediate crisis that might be happening, but also what is the intersection with other mental health and wellness needs that the person may have that's experiencing the loss. We want to involve mobile crisis resources. Here in Connecticut, we talked about how mobile crisis for youth has really expanded to that 24/7. So it's a really great opportunity to ensure that they're aware of the needs in the community so that they can respond if something comes up. And similarly with the adult mobile crisis, making sure that they're aware so that they can respond if something is coming up in the community. And then again, and really most importantly is offering grief support resources provided by peers from people who have lived experience and can really help navigate what it is like to experience a loss. Next slide. And I think I pass it on to my partners, Kylie, Emily, and Mark, to talk a little bit about some specific case examples that they've worked on.
Sure. And I'll start off just talking a little bit specifically about and I think you alluded to this, right, about what that coordinated response and notification looks like. And so typically, right, as you mentioned, we are notified about crises, including untimely deaths and deaths by suicide in a variety of ways, right? So sometimes it comes from the Office of the Child Advocate or from DCF, but other times we might hear about it specifically from school districts or people we have personal relationships with or members of our regional crisis teams. And so, I'm going to just speak generally, and then we can talk a little bit about a specific situation that we've responded to. But what we do in order to streamline the responses or the offers of support from various people that the district receives. So in our situation, Mark and Emily and I will coordinate together, right, before we reach out to a district. And make sure that we're all aware of what's happening, make sure that we're all in a position to provide some support, that we know kind of what that might look like. And then typically I'm the person who reaches out to the school district to offer support on behalf of all three of our agencies. Sometimes there might be a very strong relationship that one of the other agencies has with that school district, or other extenuating circumstances that mean that they're the best initial point of contact. And so then I'll hand it off. But it typically, I send out something on behalf of all of us, letting schools know a little bit about what our coordinated response can look like. So if a district indicates that they would like an in-person response, I communicate with them about what their specific needs are, what they're looking for. And then I work with Mark and with Emily, as well as with the regional crisis team and other community providers, such as some regional resources for comfort dogs, for example, to coordinate what that in-person response might look like. And then organize those logistics and work to make sure that the people who are responding have the information that they need to be prepared to respond, and to attend. And I think Emily is going to talk a little bit about what happens once we're at the district and maybe speak more specifically. I think we can stay on that slide though.
Yeah, if you can go back one, please. Yeah, so we're going to talk a little bit about kind of a specific example back from the fall, where a school social worker reached out to Kylie and myself directly via email on the weekend. And so, Kylie and I were in communication on the weekend and reached out to Mark to kind of talk about what this response would look like. Kylie had contacted the regional crisis team to see if there were other folks who would be able to assist with the response, because they were looking for, I want to say it was probably about 5 people or so that first day. My team specifically, there was 2 of us who went, and again, then folks from other schools. And so kind of what this particular one looked like, the day started with a staff meeting in which all of the folks from the RCT were present as well. And it was the staff had already been notified at that point about the loss of the student. And they were just kind of planning about what the day was going to look like. And again, at this point, Kylie had already talked with the principal and kind of provided some support and some guidance on that. At that point, the various members of the RCT kind of got stationed at different points throughout the school, right? So some of us were set up in the library, some of us were in the students' kind of home department. And we're really just kind of available for staff and for students to kind of come down and talk as needed. The mobile crisis team, more specifically, they kind of call us in if there's a kiddo where there's a more kind of acute presentation. They're questioning whether this child maybe themselves is having thoughts of suicide or is just, so overwhelmed and distressed that they really need that more individualized clinical attention. So in this particular one, I went and met with a student, and at that point it was determined that this kiddo did actually need an assessment by a mental health professional. So helped, connect with this kiddo, and mom was there as well at this point, to a mobile crisis clinician to meet separately. Kind of end of the day, all the folks come back together and kind of debrief. Kylie, I know that you were, ongoing coordinating with the principal and the staff to kind of talk about what the ongoing needs were going to look like for the rest of the week. The RCT and mobile crisis, responded for 4 days. Each day there was kind of a couple less staff were needed. Mobile crisis was available on standby as needed for one of those days. They didn't think they were going to need someone. And then midday they said, hey, can we actually have a clinician come to the school? We are finding that there's still some need kind of with, kiddos looking to find a therapist to talk to or having someone available to talk to. And so my team was fortunately able to send someone down kind of last minute to be available for those staff and students. Another thing was, we meet with, again, the students, but we also do meet with the staff. And so there was a staff member who I'd been talking to kind of throughout this, who was very visibly distraught and distressed and really struggling to kind of manage some of their thoughts around, the suicide loss of the student. And so, gave that staff member information about adult mobile crisis services as well, and kind of what that would look like if they were to utilize that resource. And then kind of after that, after this initial kind of grief response, there was some follow-up as well. And actually, I'll hand it off to you, Mark, to talk a little bit about what that piece looks like or looked like in this instance.
Sure. Thank you, Emily. Big piece of it is I thought Stephanie did a great job of explaining the notion of, postvention is beyond the crisis response. To the credit of the 41 communities that I work with in Eastern Connecticut, their response on a crisis side is usually appropriate to bring additional staff in. The beauty of this model is having outside providers, right? Having that partnership with community to amplify and increase your own internal resources. Some of our communities are pretty small. The mutual aid aspect is also helpful. You have people that are not directly impacted coming from other schools, but talking to other school personnel. There's a certain language that exists between two social workers or two psychologists that work in a school that's very beneficial when we're providing the postvention services. But more importantly, it's beyond that crisis period. So after we go over those days of being there, what are the steps the school is going to take when we're talking about memorialization? How are we going to, is there action steps or things that are people doing? And we want to do that in a safe way, as Andrea messaged, making sure it's safe messaging, that the steps we're taking that are safe to avoid potential contagion and future losses in that community. So what we do is, as the coordinator of the RSEB, is provide some guidance on best practices when it comes to those topics. What are some things that they can safely do to memorialize? What do you have in place for ongoing grief and loss? We don't get to pick when grief and loss ends. So we have to recognize that some students are going to go through that journey on their own. And is there a plan of care that exists both internally as well as external resources? It's also important to recognize how you're going to care for the staff. Are there going to be opportunities? So as I'd mentioned in my previous slide, we at CRAC were asked to come in 4 to 6 weeks after the loss and convene a post-traumatic stress management group that was attended by staff and students, just in a 90-minute opportunity to have a guided conversation based upon some circling and restorative practices, just to give everyone an opportunity to be heard and give them space to recognize how they're impacted by this loss. It's important as well. It's actually the very district that we're talking about in our example today is the one that Stephanie references that has now been reaching out and recognizing what are they going to do for the upcoming graduation. It's important to recognize good postvention includes anniversaries, teams winning championships, graduation, awards, all of these things the students remember. You know, the students remember. It's us as adults having someone to be that keeper of records to know when we need to sort of alert our staff to be on more aware of what's happening in the school body. So in this case, the social worker took that lead and has been very proactive. There was some interesting and unique things that come from every response. I would say the other important piece is post activation is finding out what happened. In this case, I'll just throw out there that the rally point for the students that needed services at one point was going to be used as a library. The school hadn't told the librarian, right? So the librarian has all these students and staff that are coming there, and there's other outside resources. And it certainly wasn't a barrier, but in future references, like where are people gathering and are those people informed? So each case, we try to gather as much information and use it as we move forward when we do other overviews of postvention. So that's it for me. And I think I turn it over to Stephanie, I believe.
Thank you. Next slide, please. So I think Andrea mentioned this a little bit in the beginning, but we wanted to circle back and just make sure that we're also talking a little bit about taking care of the ones who take care of others as well. It's important to recognize that suicide response can also impact us as responders, right? And so postvention efforts can really impact us. And so we want to make sure that we are also talking about how self-care is really important and embedded in the postvention response. Again, the factors that also heighten this include if you have a personal loss with suicide, if there's a personal history, the amount of time that's spent or how connected you feel to the loss of the community. Again, I think, anything that's sort of reminiscent of something that you yourself have experienced. And then also just really recognizing in yourself how you're reacting. Next slide. So ensuring that you're taking care of yourself is also hugely important. Whatever that might mean for you, whether it's taking care of your physical health and body. I know that when I'm personally really stressed with my job, I tend to watch like really bad like TV, meaning like really dumb shows that are sort of mindless, right? That's how I decompress. But making sure that you identify something that's for you and that works for you, whether that's talking to somebody, taking your spiritual health into consideration. But whatever it is, we really want to encourage everyone who's involved in this work to also make sure that you're taking care of yourselves. Next slide. We also want to provide everyone with some guidance and resources. So here we have a lot of resources related to exactly what we're talking about. Oops, one back. Thank you. We just want to highlight a couple of things. Again, the After Suicide Toolkit for Schools, the Postvention, a Guide for Response on College Campuses. Those are really great resources. But all of this, I think someone has popped it in the chat as well. So take some time and kind of explore. There's a lot of great resources out there. And then it's really about coordinating the response that your state or team can really provide to the community. Next slide. And this is our contact. Again, we are from the state of Connecticut. And if you have any questions or anything, you can feel free to reach out to any one of us. And with that, I will pass it over to Janelle.
Thank you so much, Stephanie. And thank you to each of you for the wealth of information shared today. I personally definitely learned a lot. And I'm hoping that we can just engage you for the next few moments in some questions. I think it's been really powerful to see the impact of your collaboration and those communication pathways that you have set up. In terms of really sustaining your collaboration, how is that done? So are you meeting regularly? Are you using a shared system of communication to coordinate response? I'm hoping you can speak a little bit to that.
So I can speak a little bit from the state side and then pass it over to Kylie or Emily regarding that response. But typically what happens is on the state side of notification, the Office of the Medical Examiner, once they have a confirmed or suspected death that is untimely, they will notify the team internally, sort of the state partners, to notify us of the basics of information. From there, the Department of Children and Families will then notify the mobile crisis teams. And then Andrea from DEMIS will notify the adult mobile crisis as well as the Regional Suicide Advisory Board. And then from there, that's where the local team will sort of respond.
Got
Kylie
it.
or Emily or Mark, anything you guys want to add to that?
Sure. I'll add that I think one of the things that really helps us as a team is that we tend to communicate about these things as they occur, but we meet both Emily and Mark are members of the regional crisis team, and both Emily and myself are members of the Regional Suicide Advisory Board. And so both of those groups meet on a monthly basis. So we have this opportunity to interface with each other and to communicate and coordinate around, like, at least on a monthly basis, at least not twice on a monthly basis. But there's other places where our work overlaps where we get to communicate. And so I think that having a strong foundation of like collaboration to begin with has been really, really helpful in our region for that communication when a crisis occurs. We're not strangers to each other.
Mhm.
If I could just add, I think the other thing that's really important is that the state agencies for some time now have really modeled the collaboration at the state level. We're not just telling people to do it, but we're doing it ourselves, and we're putting it into our contracts with our providers. And so that really does help to solidify things. We are talking about developing a memorandum of agreement to formalize across all of the state agencies and partners as well at the state level. We've been doing this as part of a collaborative agreement under the State Suicide Advisory Board for quite some time, but there has been discussion about really putting it into a formal MOA as well.
Thank you for mentioning that, because that was one of my follow-up questions. Mark, over to you.
I was just going to say that, coming from state service and entering nonprofit, not recognizing territory and sort of barriers, we want to be inclusive. I consider the Regional Suicide Advisory Board a big tent. Everyone's welcomed in. I was already in place, and Emily was already working in the area when Kylie's group came on board. It was like, welcome. How do we collaborate? How do we coordinate? How do we not duplicate? And the other thing I think we've touched on, but it's critically important, as someone who may receive that call of offer of assistance, you can be inundated with well-intended people bringing their services to your attention. How do you pick? How do you sort of navigate that, I'm assuming, as a school professional? And I believe that we find a way to get the person closest to it, and we can speak knowledgeably about what other things that the other entities can offer. So I think it's about relationship building. The fact that I know these two people in a way beyond, I don't have to introduce myself. It's not a cold call every time, is very helpful.
Thank you all. Mark, I want to turn it back to you for a second, because you did mention suicide contagion, which really occurs when suicidal behavior is imitated. And we know that sometimes contagion can result in a cluster of suicide incidences. So I'm wondering if you all have any strategies that you've used specifically to support suicidal contagion and these suicide clusters.
I think that's the basis of having a well-developed post-vention plan, right? That's the sort of, as you saw on some of our slides, it's really geared towards how are we going to speak about it? How are we going to identify our community? How are we going to share that information? How are we going to have conversations with both internally as well as externally? How are we going to give those partners and parties that involved in an organization, in this case a school, the tools necessary to keep an eye out for those people that may be struggling after a loss? The classroom teacher, young people don't really care, in my professional opinion and personal opinion, what your title is. They make connections one-on-one. So you may be that young person's person that they're going to turn to, and you're going to be able to see changes in behavior. So making sure organizationally they know what to look out for. How we memorialize is also a way to avoid contagion, right? Our ability to do things and take action steps versus things in permanency is important. Andrea touched on safe messaging to our media partners. How the loss is talked about is critically important as well, because we definitely don't want to glorify. We want to sort of talk about hope and help. That has to be part of everything that goes out from internally or external sources, are all things that we do. And I didn't mention as well, when, sort of between timelines and time passing, good prevention, right? Postvention is part of prevention, and the fact that are we providing some of the trainings that the RSAB and CRAC do to our staff, to our students, is also a big piece of all of this.
And you mentioned memorials, which I know is, to your point, a part of this conversation, because you mentioned we don't want to glorify that. So that was a
Right.
follow-up question that you answered. And I think
Well-
another part of this conversation is that, from a cultural sensitivity standpoint, there may be some members of the community who, quite frankly, aren't comfortable with educators having conversations with students around suicide. So how do you respond to those community members who really may push against engaging students in those conversations? And this answers to any and all of you who'd like to respond. Any takers?
I'll just jump in and say an ambassador from that community, right? So we've unfortunately had a loss in a community that impacted, in particularly the Latinx population, and they wanted to have we don't do immediate suicide prevention training. We really rather encourage to have conversations and forums regarding mental health in that community and how that can look like. And I think it was important to have ambassadors and folks from those communities co-facilitating, co-having conversations to avoid some of those things. Recognizing awareness of the communities that you're working with, being open to learn about other communities and how they view mental health or suicide in particular. Suicide is not something, when I'm riding on a plane and tell someone I'm a suicide prevention person, the conversation kind of stops. So if that's happening in an airplane, that happens in communities, people whisper, and we got to remove it from the shadows, but also particular communities have certain feelings about it, and we need to be open to have those and see what's the best entry point as well. Is that through talking more about depression? Is it about talking about other topics?
Thank you so much, Mark. Would anyone else like to respond before we move on to our resources? Okay, well, thank you again so much to each of you. Again, just truly a wealth of information shared, and it's really great to see the efforts happening within your state. As you can see here on the screen, the REMS TA Center does offer various resources that touch on this topic and subtopics that have impacts on the work that you are likely doing around suicide prevention and intervention. You can access all of these resources on the REMS TA Center website using rems.ed.gov, including a fact sheet on hate speech and bullying. We offer a training on school behavioral threat assessments, which can be kind of a part of that suicide risk assessment process. As Andrea and others have emphasized throughout today's meeting, it's important to have those resilience strategies set up for educators who may experience burnout and compassion fatigue as a result of supporting students. And we also recently hosted a webinar on the 988 Suicide and Crisis Lifeline and what it means for educators. So we hope you check that out, as well as the other resources that we have here on psychological first aid and other topics. I also just wanted to turn attention briefly to some of our national partner resources, including the Suicide Prevention Resource Center, which is the only federally supported resource center devoted to advancing the implementation of the national strategy for suicide prevention. And again, the 988 Lifeline is a critical resource that you can recommend if you aren't already to your schools as a tool for them to share. I'm going to turn things back to Stephanie, who will walk through a few additional resources.
Great, thank you. Here are some links to some additional national support resources. You can see here that there are specific, there are some specific ones for the military and veteran population, as well as a link to help find support groups as well.
Thanks so much to our speakers for sharing that important information. And thanks to you all as well for tuning in and for what you do every day to keep staff, students, and families safe. Please do not hesitate to reach out to the REMS TA Center if we can help you in any way. Our contact information is listed. Thank you.